Look at how this fluid behaves, straining against the walls as it pushes upward. Waking up, looking down at your legs, and seeing thick, rope-like veins bulging on your calves can be absolutely terrifying. For many women, taking a shower and suddenly feeling a heavy, painful swelling in the vulva triggers an immediate panic attack. You might feel like your body is permanently altering itself, or that your vascular system is simply failing. For generations, Indian mothers have hidden these symptoms under long saris, or suffered the excruciating throbbing of pelvic swelling in absolute silence due to cultural embarrassment. These symptoms are temporary, mechanical plumbing issues rather than permanent deformations or a sign of a broken body. Your circulatory system is currently working in extreme overdrive, handling the heavy physical labor required to build a human life from scratch. Relieving this pressure depends on specific physical interventions that assist the body in its daily fight against gravity. To fix a plumbing leak, you need to understand how your internal waterworks operate. Normally, your veins have the exhausting job of pumping heavy, depleted blood from your feet all the way back up to your heart. Every time you take a step, your strong calf muscles squeezes those veins, shooting the blood upward. This animation shows the inside of a healthy leg vein. You have microscopic one-way trapdoors inside the vessel. When the fluid shoots up, these tiny inner trapdoors instantly snap shut, locking the blood in place so it doesn't fall back down to your ankles. During pregnancy, your body is flooded with progesterone to keep your uterine muscles calm, but this hormone also relaxes the smooth muscle walls of your blood vessels. As the vein walls bulge outward, the pipe becomes wider, and those tiny trapdoors no longer meet in the middle. They leak, allowing blood to fall backward and pool heavily in your lower body. At the exact same time, your total maternal blood volume increases by 50%. These stockings only work if you put them on while you are still lying completely flat in bed in the morning, before your feet ever touch the floor. Standing up first allows gravity to pull liters of blood down into your calves. Putting the stocking on after that is completely ineffective. You are simply trapping the pooled blood inside a tight sock. Once you are up, you have to keep the blood moving. Your calf muscles are your second heart, and you need to keep them pumping. If you are standing or sitting at a desk for more than 30 continuous minutes, you must break up the stagnation. Do 20 rapid heel raises, or stretch your legs out and draw the alphabet. This forces the calf muscle to physically squeeze the internal veins. This shows the circulatory routing right behind your knee joint. Sitting tightly cross-legged puts a sharp kink in the major veins right behind your knees and at your groin. This angle acts as a tourniquet, blocking upward blood flow. Constant physical compression and active muscle engagement provide the mechanical support your one-way valves currently lack. Propping your feet up on a small footstool while sitting upright on the sofa does absolutely nothing for vein drainage. Gravity will not allow the blood to flow uphill. This comparison shows the physics of resting. For mechanical drainage to occur, you must lie completely flat, with your ankles strictly 6 to 8 inches above the level of your heart. Lie flat and pile up 3 to 4 thick, firm pillows, exactly under your calves and heels for 20 minutes, 3 times a day. Placing pillows directly under your knees recreates the tourniquet effect and completely prevents the blood from draining toward your heart. Effectively emptying the lower vascular network requires you to purposefully use gravity to your advantage, rather than simply pausing your movement. At night, you have to keep the main highway open. The left tilt sleep strategy involves completely sleeping on your left side with a wedge pillow placed under your right hip. This physically rolls the uterine boulder off the vein. Removing that heavy pressure restores massive, uninterrupted blood flow from your lower body back to your heart while you sleep. This brings us to the symptom that causes the most silent suffering, vulvar varicosities. Up to 15% of pregnant women develop these veins. Because the perineum is the lowest point, it is the first place back pressure pools. To relieve this, use the ice and V-belt protocol. Apply a cloth-wrapped gel ice pack to the area for 15-minute intervals to shrink the vessels. During the day, use a maternity V-belt or 2 layers of supportive underwear with a thick sanitary pad to provide constant upward physical support. Look at how this vessel reacts to sudden heat. Hot baths and heating pads physically dilate your blood vessels to release body heat, which draws more blood down into the area and increases the swelling. You must never massage these bulging purple veins. Remember, pregnancy varicose veins are already stretched to their absolute limits. Aggressive massage can rupture the delicate vessel wall or dislodge a hidden blood clot, quickly sending it toward your lungs. Treating delicate pelvic veins requires cold constriction and rigid physical support. Never apply heat, friction, or unprescribed herbal blood thinners. Vulvar veins do not prevent a safe vaginal delivery. As the baby's head descends, it acts as an internal compression bandage, firmly squeezing the pooled blood out of those swollen veins as it moves through the birth canal. 90% of these symptoms will naturally deflate and vanish within 6 to 8 weeks after delivery, once your blood volume returns to normal. Seek immediate medical care if a bulging blue vein suddenly turns rock hard like a knotted rope, becomes bright red, and is hot to the touch. This condition, thrombophlebitis, needs immediate evaluation. This cross-section shows the difference between a minor surface clot and a deep vein thrombosis. If one leg suddenly swells significantly more than the other, accompanied by agonizing, deep throbbing pain inside the calf or behind the knee, seek emergency medical confirmation immediately. Your body is sacrificing its own vascular architecture to build a heart and a brain for your baby. Utilizing these daily mechanical defenses ensures your vascular safety while your body performs this incredible work.